The local infrastructure of our city affects our health and well-being. This includes our physical and built environment and the services provided. Here are some things that we're learning. Many community members feel that there is not enough access to bulk billing. There appears to be a lack of access to local shops and services in the outer suburbs of Clarence, with health and well-being services focused in built-up areas such as Rosny Park. These services include GPs, dental and other health services, government supports, library, supermarkets, as well as social and support services. Transport is often mentioned as a barrier to accessing all sorts of services, including medical and health, food and activities. People are requesting more access to community-based transport. There are many accessible and well-maintained local parks, walking tracks, skate parks and outdoor fitness equipment that are mostly well used by the community. There are 3 organisations providing disability support, but there is a need for welcoming, accessible and affordable service options. There are 8 residential aged care facilities, but older people are living alone in large homes with a desire to downsize and are unable to move into local and affordable aged care facilities. This has implications for the health and well-being of the older person and contributes to the broader housing crisis in Tasmania. There is a lack of youth-specific health and well-being services in Clarence. Many of the services that are available are visiting and only available on some days. Here's what we think is happening. Community-based care and activities play an important role in supporting residents' health and well-being. It is tricky meeting the needs of the whole population of Clarence because we have such diverse and geographically spread communities. Some people have told us that Clarence is a drive-through area. They pointed out that most services are in Rosny Park and many visiting services are not based in Clarence. They also say there aren't many retail outlets, cafes, cultural and activity hubs in local suburbs. There is a need for increased health and well-being services, such as GPs, oral health and allied health services in the south of Clarence to support a growing and ageing population. Service providers say that they want to do more, but there is not enough time to do preventative health work. People report feeling isolated from health services and after-hours assistance, such as a mobile doctor. Accessibility of transport and wait time and availability of ambulances add to this sense of isolation. More and more, pharmacies are becoming a first point of call for people seeking medical or health care. People have said that knowing where to go and how to get there can be difficult. There needs to be clearer signs and entry points to improve accessibility to shops, businesses and health centres. We'd like to learn more. We want to know how we can better support individuals and communities outside the main centre of Rosny Park to access healthcare and services. With long wait times for some services, what other services and options are available to people if they can't get in, or while they are on waiting lists to see a GP, specialist or other health professional? Could things such as acupuncture, hydrotherapy, yoga or other types of therapy help? There are many accessible and well-maintained local parks, walking tracks, skate parks and outdoor fitness equipment located across Clarence. But who isn't using these facilities and why? What do you think?